Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by. This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by.
Hi, Vicky. It's Diane from the Chamber. Can you hear us?
I can. Apologies, I'm having slight issues. I'm actually at the airport.
We knew
I'm
you...
unable to dial in, so I'm on my phone, unfortunately.
Well, thank you very much for joining us, and the chair will probably be starting shortly, so I'll just turn off now. Thank you.
Welcome to today's meeting of the Health Committee. Members of the public may like to follow us on @London Assembly on the Twitter and use the hashtag Assembly Health for this meeting. Please may I remind participants to silence their devices. The main item on the agenda today is trauma-informed approaches to youth violence. However, we have a few items of business to go through first. Can I ask our Clerk, Diane Richards, to confirm any apologies for today's meeting?
Thank you, Chair. No apologies for absence have been received.
Thank you. Can we note the list of offices held by Assembly members? Can I also ask members if they have any disclosable pecuniary interest in any specific items based on today's agenda?
I just as a personal interest, not pecuniary, I'm a WAVE ambassador.
Chair. No? Andrew?
I may be one as well.
Okay. Well, thank you for declaring all these interests are non-pecuniary, but I think for transparency, thank you very much for doing that. Can we note the membership and the chairing arrangements as agreed by the London Assembly at its annual meeting on the 4th of May 2023?
Noted.
Thank you. Can we note the committee's terms of reference as agreed by the London Assembly at its annual meeting on the 4th of May 2023?
Noted.
Okay. Can we note the standing delegations of authority to me as chair of the committee as agreed by the London Assembly on the 4th of May 2023?
Noted.
Thank you. Can we confirm the minutes of the meetings held on the 2nd of March 2023?
Agreed.
Okay. Can we note the completed, closed and outstanding actions arising from previous meetings of the committee?
Noted.
Okay. Can we note the actions taken under delegated authority by the former chair in consultation with the party group lead members to agree the letter to the Mayor of London on the Greater London Authority Group Public Health Unit, the letters of the Mayor of London and NHS London regarding the London Ambulance Service 2023-2028 strategy, and the committee report on maternal health and care in London? Thank you. Can we note the response from the London Assembly Service to the committee's letter regarding the London Ambulance Services Strategy 2023-28?
Noted.
Okay. Well, that then brings us to today's main item. I'd like to extend a warm welcome to all our guests here in the chamber and those joining us online to discuss the trauma-informed approaches to the youth violence. So let me start with you, Lib. So if you can start, just say a few words. Well, I'll introduce you. Okay. Lib Peck is Director of London's Violence Reduction Unit. Dr. Farrah Hart, Public Health Consultant, GLA Group Public Health Unit. Yeah. Okay. Okay. Sorry. Okay, well, I must get this right. Mr. Martin Griffiths, National Clinical Director for Violence Reduction, NHS England.
Hello, Chair.
Thank you. Estelle Moore, Consultant Clinical and Forensic Psychologist, Head of Service, Borough Hospital, and Director of Psychological Professions, West London NHS Trust.
Hello, Chair.
Yeah. Keith Cohen, Head of the Youth Justice Service, London Borough of Lewisham. Welcome.
Good afternoon.
Good afternoon. And Marike Harskamp, Head of Policy at Redthread.
Good afternoon.
And joining us remotely is Aidan Phillips, Trauma Informed Communities Project Manager, WAVE Trust, and Vicky Hobart, the GNH Group Director of Public Health. I think, Vicky, you've gone beyond the course of duty to join us from the departure lounge of Heathrow Airport. So thank you very much for giving us 30 minutes of your time. Thank you.
Sincere apologies. Long book leave. Thank you.
No, it's good. So I'll start asking the questions, and then I'll pass it on to my colleagues. Just to get a feel from one thing I want to say, please be succinct in your answers, because we have a limited amount of time here and then a lot of questions to go through. Okay, so please, if you feel that something's already been said, you don't need to repeat it again. But let me start with you, Vicky. How would you define the trauma-informed approaches, and how can they be used in the context of serious youth violence?
Thank you, Chair. So thanks for giving me the opportunity to make a brief contribution today. London's been on this journey for quite a long time around trauma-informed approaches to violence. I joined the GLA 2018. There was work going on nationally and across London at the time around what was the best way to bring evidence to bear to tackle the dreadful toll this has been taking in London, particularly in terms of youth violence. So we came at this from two angles. One was around what potentially a public health approach would bring to the table, working with people in a particular place, in a defined community, working with and for communities and really paying attention to how we do that, bridging boundaries between organisations and between different professional groupings, looking for longer term solutions, looking for evidence base, using and deploying the data and the intelligence to do this, and understanding and building that evidence base for London. And London's been on that journey. We now have the Violence Reduction Unit, we have the NHS Violence Reduction Programme, incredible assets for the city where you think of that journey that we've been on. In parallel, some work looking at what could we bring from the literature and experience around adversity in childhood in particular, and the impacts of trauma both on individuals and what that means for the service responses, but what that means for communities and populations as well, and what that means for efforts to be put in place to actually prevent violence, working upstream. From a population health perspective, we often talk about primary prevention as working with those, really upstream on resilience and in a trauma-informed way with the whole population. Secondary prevention, working on those with no risk factors of violence, and tertiary prevention, working with those that are already experiencing violence. And through some of the work we've been doing with the VRU, uncovering really key ways to reframe some of the discussion in London, so moving away from a simplistic designation of victims and perpetrators to understanding they're often from the same communities and experiencing the same traumas. The idea of some escalator moments, so when individuals with known risk factors for violence move into actually experiencing it, and then also having a look at what happens during adolescence and what puts young people particularly at risk of violence. And I'll stop there. Thank you, Chair.
Well, thank you. Anything you want to add, Aidan?
I think Vicky gave a very good overview of that there. I think what we often find with trauma-informed approaches is there's quite a lot of similarity to a lot of other models that are promoted in a similar vein. I know I've come across psychologically informed environments, attachment-aware practice, and nurture groups which have been in schools for many years. And there's a lot of similarities here, and I feel what we can often do with trauma-informed approaches, as well as often bringing in a greater understanding of trauma, its impact, and other related factors such as resilience, is we can often build upon what's already existing in these areas when we're introducing them. Because I think it's often easier to try and convince organisations to adopt a model when it feels like an evolution of what you've been doing so far rather than something new. So I just add that to what Vicky has said there, but otherwise I do agree with what she's covered so far.
Good, thank you. And Lib, did you want to say anything?
person and understanding their experiences and seeing it in that context. And so it's thinking about the impact of trauma on social, in terms of their psychological, in terms of emotional response, and thinking about how best you can provide the sort of safe spaces, the culturally sensitive spaces that enable them to both overcome that trauma but flourish in the best way that is possible. And that requires an approach that is very much embedded in kind of listening, trusting, empathising, and putting people at the forefront of defining what sort of support that they really need. And as the previous contributor mentioned, I think it's very related to lots of other kind of approaches, all of which complement one another, which I think is good. And certainly one we've embraced in the Violence Reduction Unit has been a child-first approach, where we really have put young people's experience at the heart of our work in thinking about listening to them, trying to empower them, and making sure that the things that we're investing in are appropriate and they feel relevant to them. So if I can leave it at that, that just gives you some sense of, I suppose, our ethos and the way we've been working.
Thank you. Did you want to add anything, Farrah?
I would just echo what Liv said, and just also maybe note the fact that because trauma is often very complex, the way it impacts upon people is very complex and manifests itself, and so there isn't a one-size-fits-all approach. We talk about a trauma-informed approach, but it is just that it's trauma-informed, and it's not, okay, that means we're going to do it this way. It very much means adapting to the needs that are in front of you, and really, as Liv said, listening and trying to sort of work out what's going to work best in this situation. So it needs very skilled practitioners.
Martin?
Thank you. I think in addition to what we said about offering out support to individuals affected by trauma whose adaptations make it difficult for them to form trusting relationships and work with authority, it's important to appreciate what our experience of trauma is like as well, and how it affects our response and how we interact with the people we're here to support. So being trauma-informed is about recognising the things within yourself and your own triggers, your own journey to where you are, and how you interact with individuals when you're trying to support them as well. So from my perspective, being trauma-informed and trauma-responsive is about recognising your own journey, your own qualities, your own triggers, as well, and how that lands with individuals who have made adaptations based on quite adverse experiences earlier in life.
Thank you. And Estelle?
So if I might build on that, we might think about how do we want our public services to be experienced by people and the workforce therein. So we want to make sure that our workforce is also supported by trauma-informed thinking, and know that sometimes the things we do with people and to people can actually be harmful as well. So that the really importance of the experienced voice telling us and informing us about how we could improve, I think might then, I'm going to hand over to Keith because he might say a bit more about that. But yeah, the experience of making sure all of our systems are trauma-informed.
Great. Thank you. And Keith?
Yeah, thank you. I also wanted to add in the element of trauma-informed approach being a kind of a approach to really good workforce support development, to offer things like reflective spaces to think about the impact of the work on staff, on individuals, and you know, the kind of what needs to be provided in order to enable practitioners and teams who are working really on really at the sort of cutting edge of work around serious violence, child exploitation, child developmental trauma. And I think also it's useful to bring into the conversation sort of elements like community trauma. So, for example, you know, the impact of very significant community events on communities. So, you know, an obvious example being Grenfell or Windrush. And then the notion of recognising that in conversation so that we don't inadvertently re-traumatise through our interventions. And then the final thing I would want to add in is perhaps what's the connection between a trauma and what's driving as a driver of violence. So if we consider this in our training the sort of impact of the neuroscience of trauma and how, you know, fight, flight, fear, freeze can lead to, you know, sort of a kind of a hyper alert, hyper aroused response. which mirrors the impact of psychological, emotional harm, which is the definition of trauma.
And is it Marike?
It is, Chair, Marike, indeed. Yeah, lots already covered there, and I think particularly the process about trying not to re-traumatize children and young people when they come into contact with services or support, because I think we see a lot of children and young people stepping away from that or not engaging. So a trauma-informed approach is absolutely crucial to make sure that they are. I think the second point there is as well, and it's been raised already, is within a good trauma-informed approach, it is also about collaboration. So not only that co-production with the child and the young person, but very much also across the systems that support the child and the community as such.
Thank you for those opening remarks. I'm going to ask now a question which will be specifically a specific guest, right? But if you feel that you need to add something on, then please feel free to put your hand up and add. So all assembly members will now start directing questions specifically at some guests, okay? And then if you want to add in, please chip in. So my question now is to Vicky and Aidan, right? Has Vicky left us, or? Oh, no, she's still there. Thanks. Okay. Okay, Vicky, what is the evidence base for the success of using trauma-informed approaches to youth violence, and how can we measure the impact of this approach?
So this is not an area of my personal expertise, Chair, and I think there may be other people on the panel better placed to talk to this. I think from a public health perspective, in 2019, we worked with the Violence Reduction Unit to do some work on approaches that different services were taking in London to being trauma-informed. A few things it threw out for us. One is the high prevalence of Londoners that have experienced at least one adverse childhood experience in their childhood, up to 50% of Londoners, and about 10% that have experienced 4 or more. I think we need to think about the evidence across that spectrum, from prevention through to kind of treatment and support. And it will certainly be different what it means to take a trauma-informed approach for service users that have experienced extreme trauma and complexity, particularly in their childhood. And a lot of that evidence has come through services provided for homeless individuals, adults in prison, substance misuse, etc. I think the evidence base around, and certainly I'm not personally that close to this, working with younger people and actually demonstrating that for universal services is an area that colleagues have been very, very interested to document that evidence base. I think there's a sense amongst practitioners that there are a whole range of very effective interventions. Aidan may want to talk to this, but I'm also aware, in adolescence, even for young people that have experienced quite extreme trauma in their early childhood, relationships with significant adults can be kind of transformational. How you deliver that is the question, and how you deliver that in a culturally appropriate way and to different communities. So from my perspective, as I say, not an expert, but in terms of working with adults who've experienced extreme trauma, how that's manifest, quite a good solid evidence base and a real commitment, I would say, amongst a range of agencies in capturing that evidence in earlier years and adolescence. And I do think that is where our arrangements in London do put us in a very strong place, having the leadership through the Violence Reduction Unit and the NHS Violence Reduction Programme.
Aidan, did you want to add anything in?
Yeah, I remember as of about a few years ago, when you were looking for evidence for trauma-informed approaches and the impact they had, you would often come across anecdotal evidence or case studies of individual services rather than extensive peer-reviewed research. Now, ever since then, there's been a lot more focus across the country. Perhaps there has been more of this research that has come out than we've been able to keep up with. But I do know of individual studies which are continuing to be looked at and continuing to grow. The Diver programme, for instance, that first originated within the Met Police, but is actually starting to spread across the UK. I know they're using it in Lancashire. That's an example of where they're working directly with youth offenders, in this case within custody suites, and then via mentoring afterwards. In terms of work to reduce youth offending as a whole, though, I think a lot of the work I've seen has actually been looking further upstream. So, for instance, if you look at the work of a lot of even VRUs nowadays, there's a level of focus on school exclusions that just wouldn't have been there historically, or at least the intensity of the focus is new. And that's because we're seeing quite a lot of evidence and a lot of case studies around the impact of trauma-informed practices within schools on exclusion rates. And the connection's been made between that and the exclusion to prison pipeline, and that has been targeted as an area seen where we can actually start to get better results. I know, for instance, within London, we have programmes which are aiming to do it across all schools in Camden, Islington, and I believe in Southwark as well. I don't know as much about the last one. It's also interesting if we start to look at some other sectors and the way in which they've had an impact. For instance, I've seen in some housing sectors where they have targeted hostels which are generally have high numbers of residents, of high numbers of adversity. For instance, they may be coming out of prison, coming out of care, coming off the streets, and using psychologically informed environments or trauma-informed approaches there can lead to a reduction in the number of incidents that may have involved the police and may have led to said young people actually getting a criminal record in the first place. Similar results when they work in places such as A&E or psychiatric wards and other areas where you might see high levels of aggression and aggressive incidents than in general society. I would say as well that the violence reduction units across the country have now become a significant hub of experimentation that transcends all of these sectors, looking at different areas to tackle upstream. It really started with the Scottish VIU, originally the Glasgow VIU, and the fact that they chose to focus on adverse childhood experiences and trauma-informed practice has ended up influencing what I believe is the other 18 across Scotland, across England and Wales that has been set up since.
Thank you. Does anyone else want to make a contribution on that specific question? Okay. Yeah, did you want to come in, Martin?
There's quite a lot of work from Mark Bellis around this kind of work from Bangor and Cardiff around the benefits of this sort of work, and not just economical, but actually in terms of how it improves outcomes and collaborate services, and meta-analyses of these programs shows that there's obviously an economic benefit as well. So I think there's a growing international database showing there is a broad alignment of benefits shown by these approaches. I think we're just gathering evidence in this local context to give us more clarity around it.
Thank you. And my sorry, pardon? Farrah? Yes.
I would just add that the National Institute for Health and Care Excellence, NICE, they do recommend these approaches for children who are looked after, acknowledging that all children who are young people who are looked after will have experienced trauma in some way, and that practitioners should be trained in trauma-informed approaches. It's also recommended for people experiencing homelessness, also children and young people who have issues with where troubled behaviour is a barrier to them learning in primary and secondary schools. So it's an approach which is used in lots of other spheres. And in terms of it being related to reducing youth violence, there might not necessarily be a straightforward link at the moment. As we say, that we're still gathering evidence. But there are quite clear links to things like substance misuse. And actually, we know substance misuse can impact upon violence as well. So there are sort of chains of causation, even though some of the evidence around the direct link has not yet fully been bottomed out.
Okay. Andrew, did you want to come in?
Yes, I realise this is an area where we are data light, and it requires more evidence. I wonder what work is being done to improve that evidential base, so that we realise, even though it's 4 years, that it's still new in terms of the violence reduction unit, and you can't get a lot of data right in that period. But what's being put into place so that in 5 years' time, for example, we can look back and say this worked, or possibly this tactic didn't. So could you tell us what work is taking place there?
I could jump in on that one if anyone's interested, or was that being directed at someone in the room?
Anybody who wants to answer, really, as long as it's not all of you, because it's a limit on time, you know.
No worries. I'll go first, then I'll go next to the person in the room there. Yeah, when I said that years back when we first started looking into this, when trauma practice really started, before it became a buzzword in the UK, you would have struggled to find evidence with much strength to it. Since then, there has been an uptick. I know someone mentioned Mark Bellis, where he originally worked at Public Health Wales. They have really gone for the ACEs research and also evaluating a number of programmes. including both a programme in South Wales Police, which started as a pilot, which then led to a major programme across all the police forces in Wales. We're also starting to see funders in this area are taking more of an interest in evaluation specifically because of this reason. So the Youth Endowment Fund recently launched a large-scale fund, which was not only going to fund the project, but put a lot of money into the evaluation itself. And we're starting to increasingly see this become a key part of tenders that are being put out in this area, alongside tenders that are looking for a bit more in-depth work, and I'll talk about that later as well. So I think the people involved in the sector have twigged onto it, and the money is starting to go into it. Whether there's enough going into evaluation is another question.
Yeah.
I mean, actually, I think that was quite a nice segue into what I was going to say, because in a sense, I think what Aidan's highlighting there is, and indeed Martin did, is that there is a growing body of evidence, and that as, you know, a partnership body, we are constantly looking out to that accumulated evidence and working with our partners in health to make sure that we're substantiating this approach, and there is beginning to be that indication that it is proving successful. On a very sort of specific level, I suppose, in terms of the programmes that we're investing in, and many have already been actually mentioned just in passing today, some of the inclusive schools work and some of the Divert programme that was referenced, and we can certainly come back more specifically to those. But yeah, we are doing evaluations with all of the programmes that we're investing in. We have an outcomes framework which we spent a long time developing, which can give you a very good indication of the reach of the programmes and is increasingly beginning to give us some sense of overall impact related to outcomes. So thinking about if you're investing in a programme around inclusive education, which is obviously one of the key things, is to reduce exclusions, as people have talked about here in terms of that causal link with violence. We're beginning to see increased attendance perhaps at a school as a result of those programmes, and so we're beginning to get the data in terms of some of that more qualitative outcome stuff, which I think is really important to make the case.
Thank you for that. In terms of that data, of course, the question's going to be asked, and or could currently be asked, to what extent was the violence reduction strategy responsible for those changes of data? That's the point. So, and that's why I asked the question about data. Anyway, sorry, sir.
That's all right. I was going to come into this, but anyway.
Have I stolen your question?
Don't worry. Don't worry. No. Okay. Yes, Martin.
Just one more comment,
yes,
just to add to the community of gathering evidence. The Advanced Instruction Programme in NHS London has an Advanced Instruction Academy, which is specifically geared towards acquiring that evidence to show our practice is data-driven and evidence-based, and our PhD students and our academic partner are working closely with us to make sure that all of our programmes are evaluated and that everything we do adds to the armamentarium of knowledge around this space. So we will be our academy is launching formally in June of this month, and that will give us a basis to answer your questions directly.
Will they be sort of randomised controlled trials, or what sort of trials did you have in mind?
We're open to all forms of evidence. We know that the EFDU are very fond of that particular form of modality. We tend to use our experts and our colleagues to define statistical needs of what our programme should look like before we make decisions about how they should be constructed, right. But that is part of our programme of works.
Okay, thank you. So just, Vicky, to come back to this question is for Vicky and for you, Farrah. Okay, it's about what's the role of the public health unit working in conjunction with the violence reduction unit? Where does the public health unit add value to the work of the VRU? Is Vicky there?
Looks like she's gone. That's fine.
I think she's probably gone to the departure gate.
Possibly, yeah. So the violence reduction unit existed before our public health unit existed,
yes.
by quite a few years, and so we were quite lucky when we came on board that they'd already commissioned a report into ACEs, they'd already done a lot of work on this, and so since we've come on board, we've been helping them to sort of to build on what's already been done. So not teaching them how to suck eggs, because they already are very familiar with this area and they've already commissioning a lot of services in this space, but working them to help think about how can you make trauma-informed practice, very systematic in everything that you commission and everything that you do. So I've been working with the VRU on sort of helping them put together a framework for trauma-informed practice that we can use with partners and across the system to sort of talk about how you can do it in a really systematic way within your organisation and within your service. So also helping connect up with Martin's team as well. So we've got the NHS view as well. So really trying to help bring a system-wide lens, which is sort of the role of public health in this space.
Have you added value through helping them to set up the evidence gathering for the interventions they're making? Have you added that value to them?
They have their own research monitoring and evaluation team, so I'm in contact with the team, and if they need help, then we'll talk about particular issues. But so far, they're very competent. They've got experts in the field as well. So it's
the reason we're spending a lot of time on evidence is because we have been informed that the evidence isn't clear cut, right? There are bits of evidence, and then it's reinforcing it. So there's a need for us to demonstrate in the years to come, right, that this is something which is useful and effective. That's why we are particularly interested in what's happening about that. Yes, Lib.
On just a couple of points. First, not to lose the thread of this conversation, but also to just reference some of the work that we are doing with the Youth Endowment Fund, who are funding one of our key programmes across London, the Your Choice programme, and we just benefit from some of the things that they are evaluating and working closely with them. So just to re-emphasise, I suppose, that kind of system connection, and we'll be very much plugged into the NHS Data Academy as well, because we work incredibly closely with Martin. Getting to your point about what value does the public health unit add to the VRU, it adds some strategic insight because it is obviously facing into health much more in public health, so that is a helpful extension to the work that we're doing. It can help us promote some of the approaches that we've already taken, so we're very passionate, as I've already mentioned, about promoting a child first approach in the way we conduct business, and we think we've had influence across City Hall in the way that we've done that, and the Public Health Unit have supported that. And then thirdly, there is just making some of those connections. The world of health is quite complex in terms of how you kind of work out the different structures, and certainly your relationship sometimes with the ICB boards in the 5 across London again has been helpful. So it's a good partnership. And then kind of coming to the third part of your question, all of the work that the VRU has invested in has evaluation attached to it. It has an outcomes framework in which we are looking at both the kind of people it's reached, but also in terms of its impact. And we get a real growing body of qualitative and quantitative data that we can share with you in terms of specific programmes, and more gradually where we're trying to look at the kind of cumulative impact of the unit across London, but most importantly, and that's why I think we've got everybody assembled here, is really how all of us play that part in reducing violence across London. So I hope that kind of gives you that sort of sense of context that is quite important in terms of evaluation and in terms of our relationships.
Yeah, and just sitting there, one of the thoughts going through my mind, of course, so trauma is something which happens in every family. There's no family which is exempt from trauma, but there are some families who have inbuilt resiliences, right, in dealing with it, and how important that family resilience is, right, in the whole spectrum, right, of dealing with trauma. And I was wondering if someone was looking into that also. Sorry, yes.
I wonder if I can just contribute. I'm just taking a step back. Why is trauma-informed care such a sea change, really, in the way we think about things and bringing a trauma lens? The research of Anders and Filito, who looked at public health outcomes. So if you have one adversity in your history, then you may well survive life and carry on doing what you're doing. If you have up to 4, so if you've experienced domestic abuse, if you've lived in a family where someone's been to prison or had substance misuse, that some of those early disadvantages are so significant that if you couple that with community, understanding diversity in the community, it helps us to really predict who is likely to be in need of support, and where pockets of the community are really likely to experience disadvantage. And I think that's what it helps us to target in a much more helpful way than we had previously. So 10 years ago we didn't think like that, in my experience anyway. So I think it's been a very significant sea change, and that there is an evidence base in that Anders and Filito literature that really helps us to understand that and build on. I hope that feels a bit clearer.
Thank you. I think, Keith, you wanted to come in.
Yeah, I think I just agree with Estelle, and really to add also that I think this is why there's been quite another sea change towards earlier intervention in youth justice, which I'm a head of a youth justice service in Lewisham, and there's been a real focus on working with children before they experience additional adversity and current adversity. So how we impact to avoid sort of repeated and cumulative trauma. So it's not just child adverse experiences, but the impact of violence and victimisation, which adds to a sort of a cumulative trauma, which is a much more serious position and very difficult to address later in life, because that's bordering on PTSD and complex trauma. Mm-hmm. So the earlier we work with children and families to avoid that repeated traumatisation, I think is also an area where we're starting to see impact.
Thank you.
If I could paint a slightly less dark picture, it's worthwhile recognising that these factors, adverse childhood experiences, are indicative rather than absolute guides to how life transpires as you grow. And the majority of Londoners are capacitors and have resilience and do very well in life. And I think we have to identify those positive features that allow individuals to flourish and become an agencies given those difficult circumstances. So part of our work will be to highlight those positive features and make sure they're part of our practice as well. We can learn from our community rather than be that quite so transactional.
Yeah.
And I think, Martin, if I may add to that, I think that is important, and it is just key of that trauma-informed approach to look at those assets within the young child or within the community, and to you have that strength-based approach, and that is the positive angle to that.
Okay. Thank you. I think Aidan wanted to come in.
I was wondering if my hand was coming up on screen there. Thank you. Yes, so it was a very interesting study that was done into this in Hawaii, where they did a longitudinal study over a number of decades. And they looked at the people as part of this sample who experienced significant adversity. And yes, the majority of them, on average, had lower or worse life outcomes than the majority. As someone said there, it is dependent on individual context to a significant extent as well. These can only ever be used as indicators. What was interesting was roughly about a third of them who had as good as the average of the rest of the group, or even better. And what they did find was that in addition to the adversity, they also had a number of factors in life which linked into the development of resilience, whether that was a strong sense of community, strong friendships, motivation at school, strong relationships at home, or otherwise. All these different things would help build that emotional resilience and help us cope with moments of adversity. So yes, I certainly do agree that there is evidence out there to show that if we do focus on resilience as factors, it can mitigate the impact. And if we look at some of the resilience, some of the research close to home in Public Health Wales, they have started not only doing ACE studies, but they've created their own metric for measuring childhood and adulthood resilience. And as you usually get the trajectory from 0 to 4+ ACEs, when you look at each individual item and you break it down in terms of low to medium to high resilience, you see a big divergence in those figures as well there. So it's the combination of the two that really does make a difference.
Great. Thank you. Thank you to all our guests for setting the framework of our discussions. And now I'm going to hand over to my colleagues to look at some areas in more detail, whilst we are trying to accommodate some of the timetables of our guests who I think have to leave.
So I think we're going to move some questions, but I was hoping to come on the supplementaries on this section, so I don't know whether you want me to.
Why did you come back onto supplementary on the section which I've just dealt with?
So we'll do that, and then
we'll
circle back. So I might circle back a bit then.
Yes, okay. So do you want to come to on supplementaries?
No, I think.
Oh, okay. Okay.
But we might circle back a bit, so just try to.
Great. Okay. This is what happens when you're sharing. You get a note passed to you and you've got to respond to it. So I was just responding to some of the thing. But so, Kripesh, over to you.
Thank you, Chair, and good afternoon to all our guests. So my question is more in terms of charities and community initiatives. So to Aidan online and Marike. So how are charities and the community-led initiatives employing trauma-informed approaches to support individuals and communities affected by youth violence? And which of these initiatives do you feel have been particularly successful? So perhaps we'll start with Marike and then go to Aidan online.
Thank you very much, Mr. Hirani. I think Redthread is a service that supports children and young people getting out of cycles of violence and exploitation by integrating trauma-informed youth work in health settings, particularly A&E. So we pioneered the first hospital-based project at King's College Hospital in 2026 and now operate from 13 hospitals sort of across the country, including 3 major trauma centres and 5 hospitals in London with the support of the VRU. We can do that. And I think what we see there particularly is, without going back to sort of the previous conversations, is where that is particularly effective is in being able to engage those children and young people who really fall through the cracks. So we're not engaging with other services, or who don't want to engage, who are maybe had not been contemplating that there may be a way out or there may be a change possible in their lives. We call that sort of the reachable moment. So just at the point of real physical trauma, a fear of having perhaps no one around you, there is absolutely no one there. It's that when sort of a Redthread youth worker, or like there's other services in London, Oasis and St Giles providing that as well, support that young person, not only around their immediate safety, but also in that holistic way, trying to figure out where they need to be connected, how they go through the health system. That's a short-term sort of intervention, but it's proving really effective in terms of keeping young people safer. That's how they report as well. One thing that stands out for our particular service, I think, is that nearly 50% of the young people feel that they are less a risk of harm to other young people. So it indicates something about breaking those cycles of violence. And I think what we particularly see as well is that young people tend to engage much better with their peers and with that wider system, that they will need to take those steps forward and to, make those community links. Another part there is, I think, what I'd just quite like to highlight is that within these debates, what is often overlooked are girls and young women, because they tend not to be impacted so much by knife violence. Their injuries are far less visible. They tend to go under the radar. So in our work in hospitals, in four of the hospitals in London, we have a dedicated young women's service. That means that we can really work very closely with hospital staff, with clinicians, on making them aware what might be indicators that those girls and young women are impacted one way or another by violence and by exploitation, because they're not presenting with knife wounds, they're not presenting with those sort of traumas, they're presenting with mental health issues, with perhaps reoccurring presentations for headaches, for maybe vaginal bleeding, all of those things. And it is staff sort of being aware of that, and then really having also an opportunity as A&E staff to actually, there's one point, identifying someone at risk. What do you do then? And that is where a service and integrated youth work services in those A&E and major trauma centres are particularly effective.
I think just turning to Aidan online.
Thank you there. Yes, I first learned about the Navigators programme in Scotland, and only after that realised there was a very similar approach used by Redthread in London. It's something I've been very much looking forward to following up on at some point since. I'm going to do a roundabout answer, so I'm going to go via a different place in the world and come back here first, because there's one approach to working within the communities that was done very effectively over a number of years in Washington State, and which we've taken as inspiration for some of the work we've done over here. It was called the Self-Healing Communities Project. And it actually didn't start as a trauma-informed project. It started with its focus that you were going to bring together people within local areas, in some of the most troubled areas in the state. They were going to identify the issues that they thought was an issue, identify what they thought was a solution, and they were going to be given what were quite small funding grants, given the impact they had, in order to start implementing grassroots, bottom-up solutions. Now, it was only as the 1998 study was published that we've heard about so far, that they started to integrate this understanding of trauma ACEs and these other aspects into the wider project itself, and effectively ended up creating trauma-informed communities. Now, it was very interesting because they didn't just only start to see these significant improvements by targeting these very deprived areas, and we were talking about things like infant mortality dropping by dozens of percentage points, unwanted teenage pregnancies, high school dropouts, and in one case, youth arrests for violent crime in one county was quite specific. So we didn't just see these quite sizable decreases, but when they actually compared the results in these counties with the counties who weren't involved in the state, bearing in mind they were going to target funding at the areas that had troubles to begin with, they were improving at a faster rate and in some cases actually overtaking their counterparts when it came to these results. What was very interesting as well was because it was done as a bottom-up approach, that the investment that went in was a tiny fraction of the amount they actually saved. And they only ever researched 4 areas, one of which was juvenile arrests. So the actual overall savings would have been seismic. Now, these sort of approaches where you combine community-based, grassroots-led models with trauma-informed knowledge do show a lot of potential. And I know, for instance, in my native borough, Croydon, where there is a My Ends project, which is doing something very similar now. They're targeting West London, where is the highest rate of violent crime within the borough. They're focusing on a very community-led approach. They're bringing in all the community groups, and they are making sure they are all trained in trauma-informed practice, and that's threaded into what they do. For what I said earlier, a lot of groups, whether they have developed a practice over time naturally for their work, or whether they've given it a label like the relational practice, trauma-informed, psychologically informed environments, trauma-informed practice tends to be completely compatible with it. It usually just brings in a bit more understanding of the science.
Thank you. Thank you for that. For my next question, I think we'll go in reverse order, starting with Aidan first. And it's about funding. And in terms of trauma-informed approaches to youth violence receiving adequate funding, do you think that there's enough funding in London? And what could be done with more funding were it available? And I think funding is always a difficult question because, of course, everyone will say we can always do with more funding. But are there any approaches that can be taken, maybe looking at evidence in terms of what money is saved elsewhere in the system as a result of going through the trauma-informed approach, and seeing what opportunities there are to maybe shift funding more to the prevention side from the obviously when things get to a stage where prevention's no longer possible. Are we looking at those funding opportunities enough in London? And what more can be done? So starting with Aidan first.
Yeah, there's a vested interest there. As the person in the charity who often writes the funding bids, naturally I'm always going to think more funding is better. But no, absolutely. I can't speak much in terms of whether there's adequate funding in London in particular. I mean, we tend to see opportunities across the country. So I wouldn't know that much. I would be able to actually know the full context of in one area. In terms of where the funding can be directed, one, yes, I certainly think we should be investing more in preventative work. There's a lot of focus on trauma-informed practice right now. Brilliant, has a great impact. It provides results usually a bit quicker than preventative work, and also it provides good results from. However, we've seen historically how when we do start to invest, not just in piloting programs, but really thoroughly evaluating those preventative programs, they start to get picked up elsewhere. I'll give you one example. My CEO, donkeys years ago, went over to speak to Professor, I've forgotten his name now, but the professor who oversaw the creation of what was in America called the Nurse-Family Partnership Program. And he convinced him to bring the license over to the UK. That was first piloted from the UK, name changed to Family Nurse Partnership, and then it spread across the whole country. It's now in about 70 plus local authorities, including the entirety of Scotland. Now, that's an expensive program. It focuses right on the early years. You do get some early results, although the best results are going to come over the next couple of decades or so, including in the areas of lower youth offending. But even though it was expensive, because it was shown to have such great effect, and because it was backed by organisations such as the Early Intervention Foundation, look at their page in it, they give it a very high score, it ended up being seen as a worthwhile investment by councils. Areas need to see the evaluation, and in particular, they need to see the evaluation in the UK. They had 3 good evaluations out in the US. Areas would just say, I want to see it in the UK context. And we know there are other programs out there. We know, for instance, there's the Parent-Child Psychological Support Program, trialled in Valencia in Ireland, has had a tremendous impact on levels of disorganised attachment levels, which strongly correlate with child maltreatment and with later life problems of relationships, offending and otherwise. If we're able to pilot programs like that over here again and put the funding into for evaluations there, that can set up a chain of events across the country too. So that's one area in terms of prevention. I'll just pick up on trauma practice there. If we are to look at funding, I do honestly believe that it's better to do less effectively than it is to do more. If the funding is put into smaller areas and targeted at intensive support there, whereby these multi-year projects and these dedicated project teams work with the organisation until they're seeing impact changes, rather than just training and then hoping they do it in hindsight, not only does that have a significant impact on the organisation, it encourages the funders to keep investing in that area because they're seeing the results. It produces good evaluations that encourage other areas to want to sign up to it, and it also encourages national government to start investing in it as
Aidan,
well.
sorry to cut you off there. Just want to bring Marike in because we want to get more from the panel as well. Marike.
Thank you. I think, more funding. There's always, I represent a charity, so we will always sort of say that, isn't it? Not in the least, I think, because the volunteering community sector picks up a lot of those children and young people that statutory service aren't, because they're all at capacity, and we see that particularly perhaps around mental health. We know that mental health is a real driver around exploitation and youth violence. We also know that good mental health, just broadly speaking here, of course, is a real protective factor, and without the investment in that, and there's certainly projects going on within London and also supported by the VRU that do that, but that takes a much, that takes us, I think, away from London and towards really central government and having that will to do so. But in that respect, sort of the Vanguard project that's been going on, and sort of the new pilot starting across some of the MTCs here around really integrating psychological work as well with people, victims of trauma, not just around serious violence, but otherwise are good. There's 2 key points perhaps I would like to raise. One is around the serious violence duty. Specified authorities, since that's come into effect, in January, will need to develop a serious violence strategy, and they're currently very busy with their strategic needs assessment around that. I think my concern is, and it is a funding-based one, is like, whereas there may be strategies, how are they going to make sure that there is sufficient funding to really implement those strategies in an effective way? And I'm just a little bit concerned whether we're not just having the strategies, and of course they will direct funding and commissioning to particular areas, whether that's prevention or early intervention, sort of on that local basis. But there is a concern as to whether that will be sufficiently sort of funded, and obviously there's a role of the ICBs and the ICSs there as well. The other bit, I think, is going back to a genuine public health approach, and it's been said already, we can't do that without communities. It is about communities, and there is excellent work going on sort of community-led projects, and again, they are being supported and it is understood. But I think to have a genuinely trauma-informed approach embedded within an organisation costs a lot of money. It isn't just it is obviously it is around training. It is about really having the entire organizational processes trauma informed. It is making sure that there is that support and that clinical support for staff or volunteers delivering those services. So I think there is value in that sense around capacity building for those community-led organizations that are so important.
Thank you. I'm just going to turn to Lib as well, because I understand you wanted to come in on this. But before you do, I also wanted to ask you about the funding question, really, because I understand the tensions, if you like, in something that is, let's say, focused with the trauma-informed approach, especially if we're looking at individuals and supporting individuals at A&E, on specific individuals which would probably sort of be at most risk of being involved in some of those terrible crime statistics that we see and incidents, versus I think the tension on universal services and supporting all young people through some of the projects as well. So I just want to get your thoughts on how you match that up as well in your answer.
Okay, yeah, thanks very much. I mean, I think to your sort of original point, could we all do with more funding in the preventative field? Absolutely, yes. I mean, you know, I go out and speak to a lot of youth workers who I think we've all in different ways highlighted where they are on the journey, whether it's in the sharp end of really, you know, an A&E setting or whether it's in a community setting, and they feel the impact of not having had that funding for, 10 years. And there is a real kind of call, I think, for, much more investment to go in to youth work and much more recognition of it, and much more again in around the sort of supportive services. And I'm sure we've got somebody here from a local authority, but they would also wanted to be highlighting that those budgets have also been cut where a lot of the support services sit around. So I think there is definitely more investment required, and I think a greater onus on all of us to make the case for prevention so that it shifts where the resource is going. Within that, I think there is, and this perhaps gets to your point about, how do you use the funding that you've got? I think it's been really important for us to think about really early stages and some investment in primary school education, where we know, and we announced it last week, where we know, a lot of the kids that then have an awkward transition to secondary school and then further on are much more likely to be excluded, and then very sadly are much more likely to get involved or get caught up in or exploited by violence, have communication challenges, and we could be supporting at that level, but also thinking at the other end, and Divert, which I'm sure we'll come on to, and the A&E youth workers being really in that other sort of part of the cycle. So trying to spread that so that you've got a kind of holistic approach dependent on the impact of the programme, I suppose, is really important. But I think there are some principles around funding, and I'm really pleased that Aidan mentioned the Croydon My Ends programme, and again Marike's talked about the importance of community. When we set up the My Ends programme, which is very much focused on 8 key neighbourhoods across London, it was absolutely to do so in the spirit of thinking, how can we give longer term, 3 years worth of funding to support, and this is the important bit, communities coming up with the solutions that they think are relevant in their place, and we in their place that they know, my ends, their ends, and how do we do that in a way that doesn't repeat the problems of funding and commissioning, whereas you're pitting groups against one another, but you're trying to build that collaboration, that cooperation, and that has certainly begun to show really positive impacts. So, and then I do think there is one final point, and this isn't to argue against why we need more funding, but there is the way the system, there is an important part around systems change that we've all kind of referred to, and you will get some savings out of that systems change, and some of that doesn't require investment. It just actually requires putting people at the forefront of how you change systems and making sure that the systems are working more efficiently and collaboratively together. And we try and do some of that in our kind of coordination role, as indeed I know all the partners around here are also sort of battling with as well. But yes, definitely more money, and yes, thinking about it across that sort of primary, I think, as Vicky said, right the way through to tertiary intervention within that prevention space would be important.
Okay. So very quickly, a bit, because I think Carol and I sit on budget committee as well, since we're talking about money, and just some thoughts about the budget process here at City Hall as well, because I think a lot of the money that comes through and is announced from the VRU in terms of the projects tend to come towards the end process of the budget, when you, in most cases, you don't know how much money you have to spend until it becomes available. And in the last few years, I think we've seen increases in the project spend at those final stages. To what extent does that sort of hinder you, if you like, in terms of being able to forward plan on a lot of the projects that the VRU eventually then ends up funding?
I mean, we have been very lucky in compared to the other violence reduction units, which tend to get their funding just exclusively from the Home Office. We get some money from the Home Office and we get a larger amount from the Mayor, and that has enabled us to be able to plan more effectively. And certainly, 4 years in, we are now looking at sort of 3-year contracts for organisations, and that's the place you want to be in, because none of this is short-term quick fix. It's much more longer-term change, and so providing that financial certainty is really important. And that stealing Keith's thunder, I went along to Lewisham a couple of weeks ago, and we were talking there about how that increased funding from the Mayor and from the Home Office has enabled us to fund divert for across all of London now, and that's really key. It's now in the 12 BCUs. We argued, along with the other VRUs, that we couldn't just have annual settlements for the Home Office, and we won that case, and we did have 3 years worth of certainty, which is also really positive, I think.
It's okay to very quickly come in on that point, because I remember a number of years ago I went to visit another VRU in the country, I won't say which one, and this was back at the point when VRU funding was literally year by year. Like, you only knew how much money you had for the next 9 months and no more. And I do remember them going through the programme they were delivering, and they were clearly ambitious and they were spanning a lot of sectors, but the approach they were using was designed to the fact that they only knew the people in the room were guaranteed to be there for 9 months, rather than what they would have ideally wanted to do and knew would have had the greatest effect. So I've seen how shorter funding cycles can have a negative impact in terms of long-term planning. And I remember when I spoke to the Home Office not long ago, and they said, what would you advise in this respect? And I said, guarantee the funding for as long into the future as possible, because that's what worked with the original Scottish VRU.
We need to press on this point now. I'm going to bring back to resynchronise where we wanted to be. So, Emma, over to you.
Thank you. I'm going to jump all over the place because we've jumped into some of my latest supplementaries and my early ones, so bear with. Yeah. So if I continue from where we were then, perhaps on the VRU funding, can you confirm what that is for this year?
So our budget is we get 9.3 million from the Home Office.
Microphone. Can you put your microphone?
Sorry. So our budget from the Home Office is 9.3 in this financial year and 9 million in the following year. And our mayoral receipt is more in the region of, and I can't confirm that figure, is more in the region of about 20 million.
Okay, I'm looking at a figure,
and I can confirm that obviously after the exact figure.
I'm looking at a figure at 42.6 million.
Budget versus spend, then.
So the spend is 40. So tell me the difference. And go on. You're saying budget versus spend. You tell me what you think in terms of the figures then, instead of me.
Okay. Well, broadly, our overall budget is 43. But our actual spend is obviously less than that, because some of that is contingent on, year-on-year spend.
Okay, so which
I haven't got that. I'm afraid I haven't got that figure in front of me, because I wasn't realising we were getting into finances today. But obviously, I can provide that for you.
Always get into the finances. Okay. Money makes the world go round, doesn't it? So 43 million pounds in the budget, but that's not all being spent. Mm-hmm. There's still money that's
some of that is looking
in the VRU and could go to projects.
No, it's addressing the point that Eamon's just talked about, is continuity of projects.
Okay, so that's money that's promised into future years. Mm-hmm. Yeah. Okay, perfect. I was interested, actually, you were just talking as well about the primary school transition programmes that you're running. I used to work on those, so I know how important those are. But I want to know, is that the youngest that the VRU is funding trauma-informed services?
Yes, it would be the youngest, yeah.
And
we have we look at young people from the age of 0 up to 25.
but I would say that a lot of our work is in that sort of secondary school age, which is obviously 11 through to 18. But obviously we are doing work in primary schools. I've just highlighted one of those programmes, which is around the sort of speech and language, and there are a cluster of other things that we're supporting through Tender and Nurture, which is around the healthy relationships, conflict resolution, some of which involves primary schools, particularly through that transition of primary school kids going into secondary school. We do also have programmes, as we've just talked about, which take a kind of community lens. So My Ends may well be involving younger people, and we do have a key plank around parenting as well, and a whole family approach. So in that way you may obviously be involving more primary school or younger children, but primarily it is a lot of our focus has been on adolescents.
And have you thought about shifting that at all? Because I've made this argument before, that this violence reduction work starts, if you start it in early years and in primary school. The transition projects are great, and also moving into adolescence, but those are your key groups, and to just not have the focus work there, I think, is missing something really significant from the violence reduction work.
Yeah, I mean, absolutely. There are lots of points at which we want to be intervening, and with younger children that is also the case. And I've just sort of illustrated where some of that funding is going, and we're constantly looking at where we can have most impact.
I wonder if I can add, Liv, to what you're saying, that the VRU funds local authorities to around violence reduction programmes, and when we're thinking about prevention, schools is really key. And we're in Lewisham, for example, and I know in other boroughs we use that money to implement restorative approaches in schools. So, a whole school approach to relationship-based work, training staff around conflict resolution, peer mediation, trauma-informed as well. And we recognise the importance of working with primary schools with that money, and particularly focusing on sort of year 6 of the transitional period, which we know is, particularly a difficult transition. So it's one of the things I think is useful about trauma informed is often called sort of whole system approach as well. So we wouldn't work with a secondary school and not think about, primary.
And I'll just highlight again and say, from a professional background, it's from early years, primary schools, and we're missing a trick whilst we don't focus work there. But I appreciate it, and like I say, a big advocate of the transition programmes and not doing that down. Was it Martin or Estelle? Sorry, I saw. No.
I just wanted to pick up on that. I mean, much as I appreciate the benefit of focus pieces directed at looking at violent outputs, I think we've done great work with ICON, looking at shaking babies and encouraging healthy relationship with parents in obviously the earliest of years. Look what Sure Start's done to improve outcomes in that space as well. So there are interventions that sit in that space in very early life that encourage healthy relationships.
I absolutely know there are. What I'm saying is the violence reduction unit should focus its work on there.
Sorry, do you want to continue that?
I'll come back.
I wouldn't want you to think we're not focusing. It's just how much you manage to do that across all of the different programmes we're talking about. I suppose that's what we're trying to emphasise. So we are obviously investing in primary schools, and we're investing in parenting networks across most of London, most of the London boroughs. So I suppose within the budget that we've got, you have to start sort of flexing where you think you're going to have the most impact. But certainly heard that you're particularly keen on primary school age children, and that's where you think we should be investing more money.
And early years. Early years is before primary school. But I think that point and what you're saying comes to my next point around this data thing. I still don't understand. If I want to understand fully all the projects that are being run through the VRU, if I want to understand, all the outcomes, where's the best place to go to get that information and to fully understand that?
Well, you could start in many different ways. We could obviously come and talk to you in more detail, but essentially we have a strategy that frames up the journey of a young person, and we look at those key points at which a young person would want support, may want encouragement, may need increased confidence, and our programmes sit along that journey, and that's been developed with young people. In addition to that, we have an outcomes framework which translates that into the things that we are looking for from each of the programmes that we're developing. So, for example, our priority areas are encouraging a whole family approach and resilient parents. It's looking at an inclusive schools and therefore reducing exclusion. It's looking at keeping young people away from harm and exploitation, and looking at positive opportunities for young people. And then finally picking up on that final point which we were just discussing around sort of place and the importance of community-led. And you will see each of the programmes in there. You will see an evaluation attached to all of them and an outcomes framework which we are in the process of turning into an interactive dashboard, which means that you can have a look at, put an arrow over it and get a profile of what investment is going into each of the boroughs and see that visually and see what kind of young people we are supporting. So yeah, I can send you the strategy and I can send you the outcomes framework, and then if you've got further questions from that, absolutely very happy to talk through them.
Yeah, I'm thinking more from obviously in the investigation in terms of a member of the public. If I'm trying to look for more information and to understand those strategies, where you would think is the best place to see everything at once.
Well, it's on our website.
Yeah.
Well, our website. It's on the website. Yeah.
So the outcomes framework and the strategy.
The strategy is on the website, and an indication of the outcomes framework is there as well. Yeah, and once we've got the dashboard, then our intention is that any member of the public can actually use it as a tool. But as you can appreciate, that's taken some time to obviously operationalise, but very close to being able to do that, which will really take us ahead in strides of the kind of information that will be open to everyone.
And when will the dashboard be ready? Sorry, I didn't. If that was
probably in about the next 2 months, because we've got a dummy copy at the moment with some of the statistics attached to it. But we are, we wouldn't be quite ready to upload it at the moment.
Okay, thanks. And I wanted to swing back again to the point you were making about working with the Youth Endowment Fund around their framework, because when I used to work with the money from VRU versus the money with the Youth Endowment Fund, there was just a massive gulf in what you were being asked for evidence and to put into that Youth Endowment Fund. And I think this was at the very beginning of the Violence Reduction Unit. So I think using them, so I'm sure it's come a long way since that was the work I was doing. But I think that using that model from the Youth Endowment Fund and how they measure outcomes would be really good. Is that the model more or less that's being used at the moment?
The Youth Endowment Fund do rely very heavily on randomised control trials. That is actually sort of the DNA of the Youth Endowment Fund. They won't fund anything unless there is some element of a randomised control trial, and we in the VRU wouldn't be using that. What we would be doing, though, is drawing on the assessments and the evaluations they do of what they think are really strong interventions. So, for example, they rate different interventions, one of which they highly rate. I think in their sort of top category is youth workers in hospitals, and I think one of the other ones that they highly rate is mentoring, and I can't now remember what they don't recommend, but we would broadly follow that evidence. But in terms of how we would actually conduct evaluation of a project, we wouldn't go down a randomised control trial route.
I think it is quite useful for obviously trying to prove how integral the trauma-informed early interventions are, though, and to get that more funding perhaps from the Home Office, or to convince a future mayor that this is an important programme. Could you explain to me more why you think that that's not a good method?
Well, I mean, I think there's two sort of distinctions here. The Youth Endowment Fund is set up purely to do really a lot of evaluation, and so they've got 200 million over 10 years to be able to build that kind of infrastructure. So that's slightly different to us, I think, and slightly different to people around the table. But I think that there is, and I hope I'm not speaking out of turn here, but I think there is sort of different views on whether a randomised control trial as the essence of good evaluation is necessarily the way to go. It's quite complicated because, you've got to find different ways in which you are essentially saying, we think this is a good thing to do, but it's not going to be made available to everybody, or otherwise you don't have a group to compare the impact against. And I think that's quite difficult ethically when you're talking about young people, and I think it's probably quite difficult when you have already sort of proved that some of the programs we've talked about today, are working. So I think that's why we would be hesitant as a unit going down that route, but we absolutely would work very closely with the Youth Endowment Fund to make sure that we benefited from the undoubted experience and research that they've developed.
I'd understand that point if we were taking away, but the fact is we can't fund all these projects that need funding through that. So there is naturally control groups that emerge. But I should maybe not labour it. A really quick question: are you able to data share between the public health unit and the violence reduction unit?
Talking about the public health unit, yes, as in? Oh yeah.
So
yeah,
okay.
Yeah.
And I wanted to ask as well, my final one before moving on this is just around, Martin, you brought up the point about it being indicative, and I thought that was really important. It brought me back to a pilot that we ran with giving ACE studies surveys to expectant mothers, and found out actually that wasn't very helpful because it almost scares people into thinking this is what's going to happen. And how do you make sure that when we talk about trauma-informed, and it can sound quite scary, how do we make sure that we get through that, we make sure that people know that these are indicative? It's all about if you've got supportive, resilient family structures or community structures around you, how do we have that message as well as the message that, if you've got 4 ACEs, you're going to likely go to jail?
And I think that's part of the issue with having trials and data, is that there's a measurable that results in a pat out statement, and there's wisdom which is based on using that knowledge in a more humble and holistic space. When we speak in a trauma-informed way with our clients and people we're supporting, we don't stigmatise in those terms. We ask reasonable, humble questions about what circumstances are, and we aim to support and empower rather than define you as having a problem as such. And I think that what your point makes beautifully is that we have to have that part of our practice. I think trauma-informed practice isn't so much it's a lens to see things through, isn't it, rather than actual something you're going to buy off a shelf. And it's about taking a step back as a practitioner and as a person as to how you see the world and looking at it slightly differently. And I think that where we can run into problems is if we use a measure as saying this is an indicative feature and it's misinterpreted as being an absolute. And from my perspective, I think what we're very keen to emphasise in our practice is that these are simply indicative. I've got lots of ACEs and I've done perfectly fine. It doesn't mean it's going to pay in a certain way, but we can actually talk about the green parts, the positive bits about capacity resilience, which we can celebrate and amplify in those spaces. And I think that although it's useful to categorise certain outcomes, particularly non-violent outcomes like cardiovascular death, life, or diabetes, or length or life expectancy, not all of these things are amenable to helping us reduce violence.
I just wonder if I can join in. I'm just thinking that one of the beauties of trauma-informed working is about thinking about what's the person's experience of a service, what's happened to them, and how would you work with them to really understand that in a very anti-stigmatising way. And I hope that comes through in what we're saying. So it's really quite different to some of the ways we might have approached people's difficulties in the past, I think, anyway. So I work in a service that's all around violence, and working with people who would be described in diagnostic terms in very unhelpful, very labelling ways. And starting with what's happened to you, can you tell us about what's happened, is a really different way of engaging with that journey. So I think that we can weave that thread throughout the system. So our ACEs do recognise and realise the impact of trauma, but then what we do with it is the trauma-informed approach. And there's further to that is different to trauma treatment, which is about acknowledging and working through processing the trauma and thinking about the psychological impact. So that's a separate area again. Hope that helps.
Can I circle back to a previous question you asked about randomised controlled trials? As a surgical scientist, there is a thing around those interventions. I understand the hierarchy of evidence that RCTs can be appropriate for defining information in certain spaces, but there are lots of other ways of defining information that's equally powerful. And in the support and intervention space we're working in, RCTs aren't necessarily appropriate. They can be quite deleterious. They can deny equity and fairness in spaces. And I think that if you have a service which you think is working and you deny it to a community because it's part of an RCT, the ethical considerations are quite significant. From my perspective, I think we can glean information from observation and appropriate support and intervention. I think there are ways of defining statistical significant answers which are powerful, that don't require quite such bold terms. I recognise that the EF have a very educationist view on the pedagogical response in that regard. They like to have that kind of data around it, but I feel that we've gleaned from numerous other forms of study useful information that allow us to shape practice and experience in a helpful way without defining them purely on RCTs.
I take the point, right, but again, I kind of come back to this. If we say that we're denying that same support, then we shouldn't have any grant funding at all, because by that point we're putting money into a group where we think a service works, and another group in another area of London aren't getting it. It's happening. Do you see what I mean? I don't follow it for this because it's happening anyway. It's not a service being pulled from a certain group. We're giving one, but I don't. That's what I'm struggling to understand in this scenario. But
perhaps I could take it offline. I can give you some more information on that another time.
I think that's helpful because I think part of our study should really be showing where research is going to be most helpful, and so that's and how we can prove trauma-informed approaches work. And so that's why I labour the point, because I think the EF has been quite well respected. I'm asking because I think how can you get that those answers if the different way? If that's not the way, then of course you know better than me. But I'm just trying to understand. I think
I want to make progress.
Yeah.
Because we are running very late, right? And if you don't have another retrospective after the meeting, we're on the right path. So let's see how can.
So yeah, I think. Sorry, I'm just going to go to you, Marike, because I think you have to leave shortly, perhaps. So sorry, I'll come to you first. Just wanted to ask, what has been the impact of the youth work in the hospitals programmes, and has this programme improved outcomes? I think you started going into a bit.
Thanks, Emma. Yeah, I did, and I think part of it, the very fact that once it was first piloted in 2006, the very fact that it's been rolled out nationally as navigator programs, that many of the VRUs are actually investing in it, is, I think, indicative of its impact, of how well it's understood. I think what we're seeing, sort of for us as Redthread, in London, we work with sort of over 2,000 young people every year. These are people really at the sort of acute end, mostly in acute needs. And again, many will not have been picked up sort of by other services. I think just going back as well, back to evaluation and learning. I mean, I can't tell this now, but I do know there is an evaluation soon to be published about the actual impact of hospital-based intervention projects such as Redthread. I think that's coming up sometime in June. So there is learning I can't share here, but that is certainly sort of coming out. And I think within sort of other evaluations, because it is in terms of the impact, what really comes through is the importance, and it's going back to what people around this table have been saying, the importance and the impact of that relationality build, having that relationship with a child and the young person in ways that they've not experienced before, because lots of us done to them, it's not necessarily with them in a way that is trusting, in ways in which young people, children understand how to be safe and how to be safer and what the ways may be out, and in how they can better sort of engage with the services around them. So it's linking that back in, and that can't really be done without the trauma-informed approach, because it is then not, again, like with them, it's not informed by what a child or young person want, not informed by how they make sense of their experiences and as experts in their own life.
Who's doing that evaluation?
Sorry, I missed your question.
Who's doing the evaluation? You said during.
That's an external evaluator. I'm trying to remember who now. I'm not sure. I'm looking at it, but it is academic. So it was thoroughly evaluated.
So the initial evaluation was done by MOPAC for the first tranche of services.
Sorry,
the initial evaluation was done by MOPAC. But there's the new one that's coming out, I think, with a different partner. And I think that the first evaluation looked at a number of blended models of care that sit within the London area, working in the MTCs, major trauma centres. They said they were all beneficial. I think that's, Marike points out.
You could write to us, tell us who they are, or you could write to give us information. I said you could write to us and let us know who the evaluation has been done by.
Yeah, and it will be out very soon, is my understanding. So.
And do you know how, through that evaluation and through your work, you're measuring those improved outcomes?
We do. I think the expert and Lip sort of mentioned that as well. There is an outcomes framework that each of those commission services really have to work towards. There is really a robust sort of performance monitoring in place as well, and it is around not just making sure that services actually stick to what's been agreed sort of contractually, but it is also really to inform learning. And I think the beauty of those sort of programs is as well, it's not just one partner, there are other partners. There's a lot of sharing of information, of learning, of ways in which we sort of can improve services, what we learn from children and young people, what we learn from each other well. So there is that added value in that sense as well. Sorry, Martina, see.
More specifically for this project within the hospitals, yeah.
So we work with a number of partners and we establish community of practice and with all the stakeholders deliver these kind of programs within the emergency department stroke hospital environment. And we've produced guidance which I can forward to you showing how we evaluate those programs. I think in terms of outcomes we can talk about like headline things like reduction of readmission rates. I mean, we've had significant drops in readmission rates. Even the worst program reduces readmission rates by about half in terms of young people attending to emergency departments, and that has a significant financial and clinical impact. We look at how young people pick up services and interact with services and return to home, return to school. There are good data around that as well. So we can show that these programs, by establishing trusting relationships with culturally competent individuals, are resulting in changes in behaviour and changes in lifestyle which are reducing the risk of violence in those people who have been affected by it. And we're very confident that that tertiary prevention in the hospital environment is a very effective way of reducing violence in that space.
Thanks. What has been the impact of projects co-commissioned by the NHS and VRU and MOPAC, and is there sufficient and effective collaboration between health services and the police in London? Do you need to leave, Marike? Shall I come to you first?
I am really sorry. Yeah, I will have to have a health emergency at home in the family.
Okay.
Yeah.
I was noticing. Don't feel that you have to stay. I mean, if you want to say anything quickly before you leave.
You're welcome to stay, but if you need to go, just.
Thank you, Chair. Yes, my apologies.
Shall I say it again? Or
Thank you for coming along.
Thank you.
Yeah, thank you.
You wanted to talk about the relationship between, I think, the VRU and the NHS? Is that right?
So the questions about the relationships, I guess, between the VRU, NHS and MOPAC, and whether health and the police services as well are joined up in London.
Yeah, I mean, so we, enjoy a great relationship with the NHS Violence Prevention Programme. We do that at several different levels. Myself and Martin meet regularly. We talk about a strategic approach to the work that we're doing. I benefit from, his insight into what's happening in the NHS, and we try and adopt and talk about the same kind of language when addressing problems. So there's an enormous amount of kind of shared, I suppose, vision and strategy around that. We obviously draw on any research or any data that they've got, and I think the NHS Data Academy will be really helpful in that. We promote the same kind of things to agencies across London in terms of that sort of perception, but we also work collaboratively around programmes. So Martin's referenced the Vanguard programme, which I'll let him talk about further detail, but we've been very, very supportive of. Or either of you, sorry, Estelle or Martin. The Vanguard programme, and I've already referenced the Your Choice programme, which is a big piece of work that we got initial funding from YEF4, which is trying to reach 2,500 young people at risk across all of the London boroughs. We've been working closely with London councils there and, of course, with our NHS colleagues. It's sort of every level, really. We sort of see, I think, the benefit of that relationship. And we also know, and I referenced it earlier in terms of the public health unit with inside City Hall, reaching into big, complicated organisations isn't always easy, and yet we do know that if we're really going to tackle violence, everybody needs to be moving in the same way. So we benefit from relationships through the ICB boards and through other parts of the NHS, which Martin and team kind of facilitate. So it's a good relationship and one that really pleased has developed as both units have developed.
And Martin and Estelle, if I could, I'm just going to add one more question and then you can add on to Libs and take that one as well. So I was going to ask as well if there was effective collaboration between teams within the NHS in London to support individuals affected by trauma, just so you can cover both.
So thanks for that. 3 questions. So we have a great relationship at systems, strategic and operational level. And I think it's a testimony to how we've been supported and energised as a health programme by the work of the VRU in sort of setting a framework for us to operate within, both at strategic level and offering guidance and support in that space, and as critical friends challenging to do work. A prime example, what we've done really, really well is mental health pieces. We've done what you've done with Your Choice and we've done with Vanguard. Have been a really great example of how we can provide mental health support to young people affected by violence, and we've managed to coordinate and collaborate to deliver impactful pieces of work which are delivering outcomes and learning in those spaces, which coordinate and build upon each other's pieces of work, and they wouldn't have existed without us having that conversation around it. I think from my perspective, as a healthcare lead within London, my job is to get the NHS doing its job properly. But as an advocate and systems lead, we have to make sure the NHS collaborates with the VRU at every single level, that we are working up at place level at borough level to make sure that that piece is working as well, and that what we're required to do dovetails with the functions of the VRU in that space. I think it's very important to have that conversation. I think our other possible questions about working with police, and that's a really good question, because I think I had a really good relationship with Alistair when he was the head of frontline policing. We had a really robust and quite positive relationship about how we built work, and I've worked with the BCE leads for a number of period of time to deliver programmes in that space. I think we do everything from strategise about how we police better to down to operational levels, putting policing teams into our hospital to make sure that we can provide trauma-informed policing in that space as well. So if you want to have a good example of what that looks like, please come to the Royal London and see how that trauma policing team are working. I mean, Safe Linden came to visit and was very impressed how we're bringing that trauma-informed practice into our policing space to make that hospital safer and more effective and with access to justice and much happier and supported clients in that space as well. So from my perspective, as a healthcare lead within this space, my function is to make sure that all the individual organs work well together. And we have a stakeholder group and a community of practice that make sure that we, as a healthcare body, are coordinated and work in the same direction. We make sure that we are offering guidance and support to the ICBs as they spin up to full function, make sure they are covering their roles. We use the serious violence duty as a lever for change to make sure we're all on the same page, and it's been a really helpful dialogue to build that. We've built that piece of work together so we can support our ICB colleagues in delivering that piece of work around it. And I think that in terms of working with policing, we've had a really positive engagement with the challenge part of the stakeholder group who are doing their best to work in that space as well. So for me, I'm very confident that we're working really well in those spaces. I think Vanguard's a really good example of what we're doing. I'd like Estelle to talk more about that, if that'd be okay.
Sure. Yeah, I think what's amazing, I don't know if you're aware, but 13 boroughs, 11 or 13 boroughs are working together with NHS. So the model at the heart of it is around sort of building that community, understanding knowledge and working with NHS partners in that. So it really enables the local community to be the access that we wouldn't have had as NHS workers previously. We have very differently in this model. So it's been a brilliant model. It's very innovative to be be drawing for all of those stakeholders in that way. And it makes a difference to all sorts of, in terms of outcomes of people's engagement, their experience of being able to talk to somebody and have access to NHS and other things that might make a very important difference to their well-being. So I think we're building that evidence, and the dashboard will be able to illustrate that really helpfully. I hope that gives you a sense of the model at the heart. Yeah.
Yeah, thanks. So, and if I come back to you again, are mental health services in London set up to meet the needs of young people impacted by trauma?
It's such a big question, Emma. I think I think what's really
a short and a long answer to that.
I know. Yeah, I'm just mindful that we were invited to be short. I think there are a lot of gaps in our CAM services, and we know that there are extremely long waiting lists. That I think in terms of this particular area of work, what we're beginning to learn is how we work together. How it's very important to work across all of to bring people together as stakeholders. Have we got it right? Not yet. Can we extrapolate from this learning? Yes. So the short answer is we're on a journey and we've got a long way to go. But Martin,
I think the short answer is yes.
Okay.
But it requires a bit of a caveat around it. There's no doubt that the emotional well-being of young Londoners is paramount in our spaces, and in terms of working with diagnosables and disorders, those services exist and are functioning to full capacity. However, there's a role for healthcare professionals in working at different levels to provide community support, holistic support with individuals who have needs to become increasingly complex, which if they aren't managed in the early stages will lead to much more complex behavioural problems, which will lead into mental health services in that regard. So from my perspective, our role as healthcare practitioners is to work within those spaces, providing those holistic support pieces that work with experts by experience, with the third sector, with the community, to support those pieces of work to help build that resilience, that capacity, that mental well-being that we're talking all about.
Thanks. And just finally, Chair, just one more thing. I think the government clearly has an interest in the VRU model, but I wonder how are our services and stakeholders here convincing or lobbying for more? I mean, has there been written representations? What work have you done to lobby for perhaps some more investment in trauma-informed services and trauma-informed services through the VRU, perhaps from the stakeholders here?
I mean, how the VRU has used its partnerships to lobby for more money from the Home Office?
Yes.
Yeah, I mean, we had the support of organisations about getting a 3-year settlement, and we won't, I mean, besides sort of project-based funding from the Home Office, we're not going to be able to expand that budget in this 3 years. I think it goes back to that original point is how we talk about the importance of prevention and how we use the work that we're doing in the most effective way to sort of make the case for, more investment from government. But the Home Office have determined our 3-year settlement, and there's not going to be, there's no budging from that, as it were, in either way.
So if that case comes up from there's been talking about a second evaluation now of the NHS programmes.
Yeah.
If that comes back and shows this is really transformative, there's no room you wouldn't lobby again then?
Yeah, well, I mean, we'd use all the channels that we've got in terms of going back to the Home Office. They organise some events for VRUs across the country. We regularly have to submit our, evaluation on how effective our work is. Yeah, we would absolutely be highlighting something, but the nature of government funding is that it's, the money that will come to us structurally will be through that 3-year settlement. We'll absolutely keep making the case, but I'm not holding my breath.
But there's not something specific you're asking for at the moment?
Well, no, other than, prevention, investment into prevention. We lobbied, I suppose there's specific things that we've made a point about. So we've referenced the serious violence duty, for example, and the implementation of the serious violence duty. We we wanted a bit more transparency over how the money coming from the Home Office was going to enable mainly local authorities to step up and implement the serious violence duty. We have been previously part of a group that the Home Office kind of coordinated around teachable, reachable moments, and we've talked about the importance of investment going into that work. So, you know, we will pick things that we know are either working or where there is a real need and highlight them. And occasionally then there might be some additional resource for it. So we're not going to be shy about coming forward. But I don't think beyond the bigger picture of more government investment in quite a lot of these areas, I don't think we'd be specifically asking the Home Office for anything else.
It's important to appreciate there are 20 VRUs in the country, and as a National Clinical Director I sit with the VRUs and we speak with the Home Office directly about what the evidence base shows us. I think we're in a good position to show what global data looks like in this space, and we are making representation that actually is resulting in significant change in terms of understanding and policy. So I think there is definitely a pipeline to changeability, and I think that we've seen evidence of that change in policy by advocating strongly at that level.
The 1 to 3 year settlement was a big thing.
Thank you, Assembly Member Best, for that. And I know that the chair of the Police Committee is here, who wants to particularly come in now.
Yes, I just wanted to come back on the piece about partnership working between the NHS, the VRU and the police. And I was really glad to hear Martin say that there was positive work going on. But I just wonder what kind of engagement, Lib, you have with the Met, particularly where some of the adverse experiences that young people have come from interactions with the police. So I've been contacted recently by a young person who was stopped and searched pretty aggressively by Met officers. There was footage circulating on social media, and I won't go into details on that because it's an ongoing case. But you know, young people are stopped and searched. They have more intimate parts exposed searches, and just yesterday I got data back from a mayor's question I'd put in 10 months ago, which reveals that 3 times as many children were searched with more intimate parts exposed in 2021 than had been told to me previously. So that instead of being 99 children was 271 children. And these experiences, which are, you know, which continue despite all the work that has gone on from Dame Louise Casey and all the other reports going back into history. And I just wonder what kind of engagement you have with the Met to ensure that the way that policing is conducted in London isn't actually worsening the trauma that young people are carrying.
Okay, yeah, thank you very much. I mean, I know you're well aware of this, but I think it is worth stating that, you know, the MOPAC has the statutory responsibility for oversight of the Met, and as such, those kind of policy points that you've just raised, or the illustrations of the impact of some of those policies on young people and how they're carried out, would very much fall within that system. In terms of how we might contribute to influencing those discussions, you know, we have, as you know, we have a very active young people's action group who have, you know, advised and given views directly sometimes to the police, but more often through to MOPAC on key policy areas. We would also, you know, as a partner clearly with MOPAC, you know, intelligence we're picking up from communities or any casework that we would pick up, we would absolutely be passing on to them to deal with. And then occasionally we have an issue which I think is very relevant in the context of trauma response, where we, as you know, we've been very vocal in getting young people people to research the impact of the Met showing images of knives online, and we have been sort of working with the Met to hopefully not proceed in that way. Other ways in which we have partnership with the Met is through the preventative agenda that we are absolutely sort of leading on, and that is making sure we're sharing data in terms of sort of hotspots. It's data in terms of different communities. It's thinking about how we can involve them in something like a My Ends programme, where they can strengthen a very place-based approach. It's helping to facilitate making sure there's a connection in with the local authority, and we really kind of come into our own sometimes at the very sharp end when an incident has happened. And I think, as I've mentioned before previously in a different committee, we have a critical incident fund that once sadly an incident has happened, we make available to a local authority, and often not only that offer, but that relationship with the local authority is carried out with the kind of gold group that is overseeing the incident. So a kind of range of ways, I suppose, in the preventative field that we work closely with the Met, an influencing role often through our connections with communities and young people, but very much sort of using some of that information to help with MOPAC's role.
Just add one thing.
Yes, please do.
Everything that Liv just said, but really to sort of emphasise the value of trauma-informed training for police, and how we can make that kind of core to the training programme that police encounter. Why we don't do that is a mystery in a way to me, and the train, because it's so key to their work. Most police officers are dealing with troubled people, distressing situations for individuals, communities and themselves, and I think trauma-informed approach is a really good way of helping the Met and other services to navigate that world which they encounter. Training that we've done locally.
Mean in terms of the Met workforce and the trauma they experience?
We talked earlier about vicarious trauma, and it's been very high in the police. So when we've approached police locally to offer training, they've been really receptive to it. There's a lot of people, a lot of officers to reach, isn't it? And it's also about, once they've had the training, how they think about what it means to become, I guess, a more psychologically informed and compassionate service. Which I think there is a will amongst police that I've encountered to do that. I think they just need the input, the training, and the investment.
Thank you. I'm aware that we are very behind on time, but I know this is an area that Aidan may have something to say. But Aidan, can you come in briefly if you do want to come in, and then I'll hand back to the chair.
No, on this area, I think the others have covered it sufficiently. So if we are behind on time, I'm happy to move on to the next one.
Thank you. I'll hand back to the chair.
We can ask Assembly Member Griffiths to finish this section off. Then we are going to have a 10-minute break, so that we can re-energise ourselves for the second part. Over to you, Griffiths.
Thank you, Chair. Estelle, I'm glad you mentioned CAMS briefly, because I was just looking back at an article in the House magazine last year which reported on the postcode lottery in spending on CAM services, with spend in some areas in the country 4 times higher than in others. And according to FOI data, the South London and Maudsley NHS Trust had one young person waiting 137 weeks for treatment, which is the 6th longest wait of any trust in the country. Are waiting times having an impact on the work that you're trying to do in terms of the trauma-informed approach?
Are waiting times having an impact on trauma-informed? I don't really know how to answer the question, Griffiths, but I'm just thinking that CAM services post-pandemic have had an extraordinary increase in referrals. Would being trauma-informed help us to address those? Most definitely. I think I was talking to CAM's colleagues just before coming here today that the I suppose you did say though, Martin, that we're making progress. So I don't know if I need to hand over to you into just how you see that.
So I would make an observation that there is a distinction between managing diagnosables and disorders in the mental health space and supporting emotional well-being of young Londoners. And I think that what we identified with our work with the mental health community, there was a need for a different kind of solution, which we need to spin up. And that's what Vanguard and Your Choice are about, to try and deliver that community-based, holistic mental health approach that provides support in that space. I'm not entirely sure about the data you're describing. We could always do with more people working in mental health facilities, but 12% of the NHS are psychological and psychiatric workers. So there are a lot of people doing that piece around it. My feeling would be that rather than focusing on that end of the spectrum, we should be establishing a better based, holistic, humble, supportive piece of work that sits in the community, delivered by appropriate individuals for the people with the support of health professionals, rather than focusing on diagnosing a child with a problem, rather than supporting them in their development.
Keith, I'm going to ask you to come in. I know you want to come on that issue as well, but just also if you can draw on the role that local authorities play in implementing trauma-informed approaches to youth violence, and how successful have these approaches been where you're working?
Yeah, so I think that local authorities in London have started to develop within their strategic vision, incorporate trauma-informed practice and also trauma-informed approaches into their corporate planning. What that means is that there's a recognition that this has some value in terms of all the different services across the councils are responsible for, from birth to death. So it's about reducing violence, and I think, in Lewisham we were a kind of early adopter of a public health approach to reducing violence. We were watching what was going on in Glasgow, in South Wales. And I think that when we talk about a public health approach, we've got trauma-informed practice at the heart of that, the core of that. So within that comes training right across the council around trauma. I mentioned the support we've given to police locally, and then I think it's also working with the community, as has been mentioned, voluntary sector. So we've got a very strong relationship with Redthread. We have also worked with an organisation that LIB and the Violence Reduction Unit have supported, called Power the Fight. But I think in terms of some of that embedding of trauma-informed as part of a corporate approach, part of the council's approach, like we said earlier, we're still in a bit of a testing phase. So there was that programme showed that there was they offered sort of a culturally sensitive support to schools, and they found that having offered this in terms of their reflective spaces for teachers, chances for teachers to kind of de-stress, take time out of the classroom, reduce the levels of stress that's involved in the work, that they found that the school relationships became improved. There was a good understanding of children's ACEs and children's trauma within the schools, and there's some really nice outcomes. So I think we've been aware of trauma-informed approaches for some years now. I think we're starting to see it embed. I think in terms of the commissioning of services, we now see that trauma-informed becomes a kind of a requirement for commissioning where money is available to commission services.
In terms of the last decade or so plus, and general cuts to council budgets, including to areas such as youth services, how has that impacted your work?
So, yeah, there's no question that we could do with more money. I think this approach has been a kind of a response to, the resources being low. So how can we reform services? How could we think about systemic change within the services we've got to manage the cake that we're given? So in relation to youth justice and youth offending, high caseloads, high levels of violence, you know, we were low numbers of staff. So this approach is a way really of managing that and supporting those staff to be able to do effective and efficient work, to be able to be, you know, as best as they can in work and support them. So we've managed to develop trauma-informed work without, you know, increased investment, and we've seen the benefits of that in terms of staff resilience, reducing numbers of children who come into the system, and so some I think a really good sort of feeling around the workplace that individuals' needs are being met in difficult circumstances.
Okay, I think we'll take a 5-minute break, right? And we'll meet again at 4 o'clock, yeah? But thank you to members of the panel for coming back. I think that the second half will go quickly, or quicker rather, than the first part. Hopefully we'll get you all out at all time you need to go. So I'm going to pass over to Assembly Member Russell to carry on, please.
Thank you, Chair, and welcome back, everyone. And thank you all for your answers so far. I've written loads and loads of notes. It's been a really interesting session. So my questions are for Lib at this point, and it's about the sort of the impact of some of the VRU funded particular projects. So there's the Therapeutic Intervention for Peace programme, which there's a list of things that have come out in their research as being things that are important to think about, like proximity to violence, the kind of the language culture barrier around therapeutic interventions, the distrust that I picked up on my earlier question about the police, the experience of young black people in relation to experiences with the police in particular in terms of disproportionality, the issue of women and girls being sidelined by interventions that are more focused on young men, and also the issue of the lack of support for practitioners. I mean, those are all things that have come out while you've all been speaking, and so I just wondered, yes, the kind of I think it was Power the Fight. Does that make sense? Yes. So could you just sort of give us a little bit of a lowdown on the impact of that project?
Yeah, sure. So we were very pleased to be able to invest in Power the Fight. Keith has actually already referenced their work because they are, or were in that context, very Lewisham based, and they went into schools and they did a lot of one-to-one therapy work with young people, activities with groups of young people as well, and critically managed to train quite a lot of teachers and staff. And what they really found, I mean, you've talked in a sense about their kind of overall findings of what they thought that was lacking, but in terms of getting back into that impact bit that we've touched on all the way through this session, they found that from sample studying that there was, when they rated some of the children in terms of the well-being measure before they went in, there was quite a lot between that kind of moderate and severe, and most of them had kind of moved into moderate, so therefore felt much more sense of safety, really, in themselves, and able to sort of prosper more in school. And I think critically, and we perhaps haven't touched on this quite enough in this session, the training of professionals in every sphere, and they were able to do that. So I referred to the fact they were able to do teachers and staff, but then when they went and sort of spoke to the staff after those training sessions, I think it was 87% of the staff basically said that they were putting into practice what they'd learnt, and many of the things that what they'd learnt are the things that you've touched on. So a very successful programme, and a really sort of organisation that I think is growing in terms of influence, but was somebody who was an organisation that spoke very powerfully about the importance of cultural sensitivity, powerfully about the individual relationship, and powerfully about the systems change and therefore the training that's needed for professionals. Mm-hmm.
And so that was a project, did you say, in Lewisham in particular?
It was, yeah.
And are you thinking about trying to roll that out more widely?
Well, I think, we try as a unit and be a space of learning, actually, and we learnt a lot from working with them and from what they were feeding back, and those are kind of principles that they weren't already in some of the stuff we were funding. They are now, in a way. It influenced some of our investment in the Nurturing Inclusive Education programme, where we work closely with Nurture and Tender, but it also put in our mind the importance, the even more importance actually, of the cultural sensitivity, and we were able then to bring Power the Fight in to talk to Nurture and Tender, so that they were able to use the findings that they'd had to influence our wider investment. We work closely with Power the Fight. We may well at some point be able to fund them more, but they're also an organisation that has their own desires about where they want to grow, and I don't think actually what they want to do is just go into loads more schools. I think they're very interested in changing the structure and the system, and therefore that training of professionals is something that they have really focused on and obviously done incredibly well. But yeah, so there is a lot of learning that we've got from them, and really good programme.
Brilliant. That's really helpful to hear about. Now, does that link in? I'm aware you've been doing a lot of work with sport. There was an amazing evening event that I accidentally went to here, where there was sponsored by the Violence Reduction Unit. There were lots of organisations like Project Zero in Waltham Forest who work with young people adjacent to violence, and it seemed that there was work going on around using sport in particular as a sort of violence reduction unit intervention. Could you tell us a bit about that, and in particular the outcomes that you felt were really constructive?
Yeah, certainly. I mean, we know from evidence that that kids are by and large safer in school. So therefore the corollary, I suppose, of that is that, when school finishes and it's the weekends and it's the after school hours, that you've got much more of a challenge. And so therefore investing in activities that enable young people to do something positive, both physically and mentally, but are also able to engender often a relationship with a trainer or a youth worker, is a really important practice that we've heard from young people time and time again about that relationship, and indeed from professionals working in that field. So to that extent, it's a bit of a no-brainer, really, thinking about how can we fund sports programmes, but perhaps picking up on some of the themes that have emerged. What is really key to that is thinking about it in the community context. So it's thinking about the anchor organisations in a particular place, their relevance to the young people, and making sure that we are funding them. So it's 17 projects who are across London who are doing that work during that time, but are able to make the connections with the young people, and you've just spoken of some of those organisations that were there. And then the second thing for us, and this was a sort of again a developing theme, is making sure that we are listening to young people. And I think the evening that you stumbled upon, but I was very pleased you did stumble upon it, was where we had a kind of a sort of young persons panel from some of those organisations who are really wanting to direct the kind of sports provision and the way that it was done. And it is perhaps, if we've tried, I think, actually as a whole panel, to talk about the importance of that qualitative evidence that needs to come through, and can only come through if you're listening to to young people or to communities. And certainly I'm really optimistic and hopeful that that panel will help to shape our kind of sports and diversionary activities in different ways we won't have thought about. That's the whole beauty of being a learning organisation. But that's reaching over 5,000 young people. It's reaching them at key moments in key places, and is having a wider positive impact on them.
Thank you. Did I see, Martin, did you put your hand up at one point during that? Did you want to come in?
Yeah, just to echo Liv's point about the benefits of sporting endeavour. I think there's also a thing about branding. The work of Charlton Athletic in South East London has been instrumental in showing what a football club can do to support a community, not just by delivering sporting activity, but social prescribing, community health work, mental health work as part of their broader offer to the community. And because young kids identify with that brand as being a safe and trusted brand, they're prepared to talk with their youth workers in that space. We found that a really useful lever to deliver change in that space via a trusted sort of partner. And I think that's something we can really hone into as we move forward.
Yeah, so you mean sport as a... you don't have those problems of distrust.
It's a trusted
brand.
A trusted brand. Yeah,
got it. Thank you. I'm ploughing on quickly through these questions. My next question is about a cognitive behavioural therapy programme, Your Choice, which I think was a 3-year project with 2,500 children and young people at the greatest risk of violence in each London borough. And I think it may have been touched on just earlier, but I just wondered if there was anything you wanted to add about that programme in terms of the benefits, the outcomes, particularly for young people. Yeah, please do.
Yeah, we're one of the boroughs involved in the
excellent.
In
Sorry,
the Your Choice programme.
Should have known that.
And there is a randomised control trial, so we're bending and shaking to make sure we can comply with that, whilst working with the children as well, the children and young people. And it's really aiming to work with those kids who are the most complex, high risk, but also very vulnerable. But also recognising that they've got mental health needs. So the role of trauma-informed work in Your Choice in Lewisham is very key. So we've got a very well-established base around trauma-informed practice. So we've been able to deliver Your Choice and adapt it, but also keeping to the governance and the fidelity of the evidence base that we're contributing to in partnership with VRU and YEF.
Yeah. Very quickly to add to that. When the programme started, it's a 3-year programme. It did receive some additional Home Office funding, actually, and then funding has gone to the Youth Endowment Fund for the next 2 years, we hope. And it had at that point 32 boroughs involved, which is extraordinary, really, and does show, I think, the relationship between the VRU and the local authorities, which we prioritise. We did actually have really interesting and lively conversations with the Youth Endowment Fund, and I know they would say that as well, around some of the material they were going to use, and our Young People's Action Group went in, read it, and found some of the materials that they didn't feel were appropriate, and YEF, to their credit, then adapted some of those. We did have challenges with the local authority. We didn't with the local authority. The local authorities had challenges around how to implement that randomised control trial and making sure that it didn't disadvantage some young people, and that was thought about through the lens of who was trained and who wasn't trained. So quite a good interpretation of a challenge, I think, and so some really good evidence there, and that is very targeted, as Keith has mentioned, but working alongside health colleagues as well to make sure that the sort of CBT practice is kind of reflected in some of the activities and isn't a prescriptive way to just do sort of therapy. So quite interesting.
When you talk about these trials, is there due to be sort of evidence presented, and what's the timeline for that?
So the efficacy of the project is being tested now by YEF, and I don't think it's been released, has it, the report? But we're really on the cusp of that.
The full young people study is now going ahead, and there's a further 16 months, so hopefully by December 24. There should be some good outcomes there, and as I say, it is literally 32 boroughs who signed up to it, and there may well be over 2,000 children that we can. 2,500 children,
Okay, so we'll make a marker for future health committees at a future time to check back in on that. And then my final question picks back up on women and girls affected by community violence, and I think there was particularly there was a point that was made. I'm not sure if it was Estelle who made it earlier, or Keith perhaps, about how the sort of there were, or maybe it was Marike actually, about young women turning up at hospital. So it's the young men turn up with a knife injury, whereas the young women maybe turn up with other symptoms and things going on in their lives that need to be picked up in a different way. And I just wonder what the VRU is doing through the trauma-informed programming to support particularly girls, but also young women who are affected by community violence.
So I suppose we're doing a number of things. I mean, we have a programme which is just directed towards young women and girls, which is a mentoring programme which we commission through a couple of organisations that are absolute specialists in that area, because I agree obviously with you that that's important. There is something about making sure that all of our programmes are gender aware and thinking about that through the lens of trauma awareness as well. We are working alongside MOPAC in terms of the violence against women and girls strategy, and thinking about that preventative strand that is really important. That's obviously at strategic level rather than programme delivery, but really important. And I think, you know, the VRU was set up as a sort of first public health approach, and it's really important for us now, and pleasing, I suppose, for us that while looking at a violence against women and girls refresh strategy, there is a very conscious adoption of a public health approach, which we've obviously been influencing. So, on all of those strands, I think we need to be sensitive to that within all of our work, but we do have some specific programmes as well.
And those, where can we find out about those?
Oh, I can certainly send you information.
Could you send us
information? I'm happy
those?
after this. Happy after this session to work through. You know, if there's a list of other things you want, then that's fine. Yeah, send that over. Not a problem.
That would be fantastic. Thank you, Chair. I'll hand back to you.
Thank you. We're nearly on the home run, and it's over to Assembly Member Andrew Brough.
Luckily, I've been playing question bingo while we've been doing, and I've been ticking off questions I was going to ask because you've been so very fulsome in your responses. I'd just like to go to Ms. Peck first of all. It's just something you said about the sports programme involving young people and actually deciding what that programme is. It's like every time I come to a committee meeting, that's a new thing. I mean, shouldn't we have been doing... I remember years ago when I used to run a youth club in Hackney, I made this terrible assumption that all the kids wanted to play football. And I thought, you know what, I'm going to innovate. I'm going to actually ask them what they want to play. They wanted to play rugby for some... I mean, not my choice, but it was their choice. But I thought this should be surely in the DNA of any services, that we involve young people in the co-design of those services. And it seems like every time I come to committee, it's a new thing. Why is that?
Well, I'm pleased to be able to reassure you then, because since the Violence Reduction Unit set up, we have prioritised making sure that we have not only got the voice or the consultative voice of young people entrenched in the work that we're doing, but that we respect that voice and we co-produce everything with them. And our Young People's Action Group are paid, they're mentored, they're offered personal support, and they're given equipment for the GLA. And in that sense, I think we have sort of set a bit of a trend within the GLA about how you really genuinely embed the voice of young people and their experience. And what I was referring to in terms of the sports programme was actually a more specific panel, which was coming from all of the different community groups that are taking part in that programme. We're very pleased that we've got that in place, and certainly it's very popular. We started off with 100 people who applied. I think that at the last count it was about over 400 young people that came forward and wanted to be considered for the action group, which is a really good problem to have because you want to be getting out and getting young people involved.
Thank you. I mean, I'd just like to ask the panel here a question, and please don't answer it if you've already answered it, and that is, what further action could the Mayor, central government and civil society groups take to improve and expand the use of trauma-informed approaches? As I say, if you've already said it, don't reply. It's because we'd have logged it. Anything yet? Anything that you haven't already said? That's wonderful.
I'm happy to come in on something that's a bit new, and actually something that is inspired by work that's happening in London. The iTips project, which is working on trauma-informed schooling in Islington, one of the good things they're doing that also inspired their neighbouring borough in Camden was not just to embed the approach and to bring outsiders involved in the whole process, but to have the CAMS teams involved right from the start, so that in the long run, you won't just have schools who are using this trauma-informed approach, you also have these local specialists who are on hand to help provide ongoing consultancy over time. I believe in Camden, they also do this with educational psychologists too. So I think where approaches are also bringing on board the local experts and making sure they're embedded in the projects, that really supports sustainability over time. And I think we're going to be seeing this in these two North London boroughs.
Thank you. And actually, I think my last question actually is to you, Mr. Phillips. Back in June, the Assembly unanimously asked the Mayor to personally meet with the Wave Trust. And has the Mayor met with you?
No, you won't answer our calls. Yeah, we've tried, but we haven't been able to manage that. I believe an opportunity to meet someone else was offered, and I can't remember exactly who it was, but it certainly wasn't Mr. Sadiq Khan himself.
Thank you.
That other person who was asked to meet with the Wave Trust. I might be wrong, but I have met with the Wave Trust on several occasions, and we're looking to do some work with them, because what we've talked about here is the approach, and what we want to make sure that we do in the in our actual commissioning process is make sure that we've actually able to sort of make sure that the organisations we're giving money to are considered to be trauma informed. Codify that a lot more, and so we are very hopeful of working much more with the Wave.
And do you know whether or not the Mayor has any plan? Oh, sorry, I beg your pardon.
Sorry, I just said likewise as well.
Yeah.
Sorry, I didn't mean to
and
interrupt.
do you know? You know, the Assembly did ask for the Mayor to personally meet. That's the point. Could you tell me whether or not the Mayor is intending to become a Wave ambassador?
I am not aware of this. I know that the Health Committee a few years back, when publishing the Healthy First Steps report, came out in support of our 70-30 campaign to reduce child maltreatment by 70% by 2030. We're very grateful for that, and the London Assembly did as well. I do not believe we've had indication of Mayor Khan's personal feelings towards that campaign. I will have to double check to be sure, but I certainly haven't come across him as a personal endorser yet.
And Ms Peck, do you know whether or not the Mayor's plans to become an ambassador?
I think the Mayor is very supportive of the Wave Trust. I know that's different to perhaps being an ambassador, but certainly, you know, is well aware of the work that we are doing with them, and yeah. I can't say any more than that, because I'm not privy to all of the exchanges, but certainly the approach and the commitments that Aidan has referred to were carried out by the Mayor. So, and I mean, in a sense, a lot of the philosophy of the Wave Trust and what we've been talking about today is embedded in the London Violence Reduction Unit. And as we've talked about, you know, he was the first person to set up the Violence Reduction Unit, and therefore, in that sense, is very committed, I would have thought, to the principles.
I'm sure, and but perhaps you should echo back to the Mayor that it was very explicit. I spent a little time researching this. The Assembly did say personally meet with the Wave Trust. But thank you very much. Thank you.
Well, can I thank all our guests for all your contributions this afternoon? Can we note the report and today's discussion? Can we also delegate authority to me as chair in consultation with party group lead members to agree an output from these discussions? Thank you. Can we note the committee work programme and our meeting dates as agreed by the London Assembly at its annual meeting on the 4th of May 2023? Great. In addition to the following up from the work the committee has done recently regarding the London Ambulance Service and correspondence received by the London Assembly Police and Crime Committee, can I ask the committee to delegate authority to me as chair, in consultation with the party group lead members and the Police and Crime Committee chair and group lead members, to write to the Department for Health and Social Care, NHS England, regarding additional resources for the London Ambulance Service? Okay. The date of the next meeting of the committee is scheduled for the 29th of June 2023 at 10:30 a.m. in the Chamber Hall, and I have no urgent business. Therefore, I declare this meeting closed.
This is the broadcast from City Hall, the home of the Greater London Authority. Please stand by.